We are going to start on a physio ball, and the intent is to help release the tension along the hips and along the ribs. So we are just going to be on the ball, and if you don't have a ball, you can be on a chair with a disc, so the discs that have the air in it. And we're just going to start with some left to right. Thinking inhaling and exhaling. So we just want to work to mobilize that fascia before we start moving into some breathing practices. Breathing in through the nose, out through the mouth. And using your hands to help lengthen through the spine. So that helps to open it up as we shift those fibers. Now we're going to hold the base level and move from the top. Inhaling and exhaling. Inhale and exhale. Opening up that side body. Make sure as you're going side to side, you're not sticking your bottom out the back side. So really think of having those shoulders close to on top of those hips. Still pressing down to lengthen through that spine. 4, 3, 2 more. And last. One on the front, the middle, and the back. So when you're perfectly seated, you're on your sits bone. And when you're slouched down, you're on the back. And when you're scooched forward, you're on the front. So we want to be perfectly centered on them when we're sitting in a normal day. We're going to rock back and forth. So when our behind is out, we're sitting on those hamstring attachments. And when we're tucked in, we're actually actively shortening and lengthening through the back, causing some lower back issues. So we don't want to be doing that. So again, it's just the tailbone. You're tucking your bottom under and then kind of back to neutral, but just enough that you're sitting on the front of those ischial tuberosities, but not like so far forward. Exhaling and inhaling. Couple more. Excellent. So pressing through the legs again. Now the upper body. So keeping that lower body underneath us, which can be a little challenging with the ball. Exhale as you come over. Inhale as you come up. Think one movement, one breath. So we're lengthening our breath here. The movement's coming from the top and not from the bottom. Two more. And last one. Excellent. So from the bottom, circling those hips around. Think of drawing a circle around with that tailbone as if you had a marker on your tailbone. Try to keep your upper body from moving. We've got 4, 3, 2 more this direction. Excellent, other direction. Inhaling and exhaling. Inhale along the back, exhale around the front. And trying to keep that upper body from moving. Last 2, and last 1. Excellent. Coming center, pressing up. We're going to move the upper body, stabilizing the lower body. That was a little more difficult because our bottom is moving around on that ball, so not as easy. So think of inhaling around one side, exhaling around the other. One more this direction. Last 2, and last 1. Change directions, taking it around. Two more. Excellent. So now we're going to take them in opposite directions of each other. So using the whole upper and lower body, rotating the body around and the hips around. Work within your range of motion. If your range of motion is just right here, that's fine. But really work into what feels good. One more this direction. Excellent, other direction. I don't feel as coordinated in this direction, so you may feel the same when you change directions, and that's okay. Take your time. Find your rhythm. Inhaling and exhaling. Excellent, and coming center. Excellent. So readjust yourself on your ball, or if you feel more inclined to move to a chair, you're welcome to do that as well. So from here, all I want you to do is imagine trying to scooch your sits bones together. So yes, we're lifting our pelvic floor, but I also want you to engage your glutes. So you can see me lifting up more on the ball than you might be able to see me on a chair, because the ball gives me a little bit of rebound. So I do have my calves up against the ball. So we want to have the support of our pelvic floor. So if we're on the back of our sits bones, our pelvic floor isn't in an optimal position. So when we're breathing, we're actually putting pressure on our tailbone, or we could be sitting on our tailbone. And the reverse is true. If we are sitting more forward, we're dumping into our guts, putting pressure onto our guts, onto our bladder. And this can lead to some incontinence. And there's a high amount of people below 30 that are now experiencing incontinence because of posture. So we want to help improve that pelvic floor, the tone of it. And of course, as you get older, we want to prevent prolapse which is when our organs start to pull out. So we don't want that to happen either. So we're doing this exercise to not only strengthen the pelvic floor, but to support our breathing. If it helps you to think of the motion to stand up, if that's what helps get you to get those going, but we want to improve that tone of that pelvic floor. A few more. Excellent. So we're gonna relax our legs so you can take them wider, whichever feels more comfortable to you, whether it's directly in front of you or a little wider. So we're just gonna trace our rib cage, and your sternum comes down and you'll kind of feel like a W. So there's the xiphoid process. So we're gonna come into that xiphoid process, and we're just going to gently roll and collapse ourselves into that area. So I'm gonna turn to the side slightly. So I'm actually reaching up under my rib cage just a little bit with the finger pads. So think of like rolling up and over your finger. So I'm kind of folding onto my finger pads, and all I'm doing is folding onto it and doing just a little bit of cross fiber friction. So that's to help release any tension that might be there. And that tension could be from the most superficial tissue, our rectus abdominis, and those attachments all the way up. And like I said, when we're up and under, we're kind of into those diaphragm areas. Just working our way around the outside. Again, we're just kind of tucking our fingers up underneath the rib cage and just allowing yourself to collapse over. So you're not holding yourself up, just slightly tailbone tucked under to soften those tissues to make space for your fingers. And coming out to the sides. You might not be breathing as deeply, and that's perfect. Coming up and under. And you'll get to a point where you can't really like get into the side, and that's okay. You just kind of like a shelf. Working our way towards the back, and that's when you might find your QL, and that may be a little tight because of the position we're in. So when you get to that point and you can't go any further, bring yourself upright, shoulders back and down, and then continue back there just a little bit. Like I say, you still may have some tension back there, and that's just kind of the nature of the beast. And I'm actually in there now with my thumbs kind of rubbing, so it can be a little bit more pokey when you're doing this. So be gentle with yourself and know that your kidneys are back there. Obviously, you're not going to poke your kidneys, but that is the area where your kidneys are. So once you feel like you've hit that muscular spot where you can't go anymore, we're going to take our fists and gently with the back of our palms kind of drum into that area. So we're doing this for two reasons. First, we want to kind of waken up the kidneys. The kidneys, they actually work with our breath. So we want to help improve their motility by using our breath. Kidneys are retroperitoneal, so they are actually behind our organs, and our breath actually helps those kidneys to move and function more appropriately. So our kidneys are responsible for our fluid and how with the erythropoietin, it tells our body how to move the fluid through our body. All right, so now we're gonna stop this. And I'm kind of leaning forward more than kind of. So if it feels better for you to have your palms up, your shoulders, prefer that position as opposed to the other, pick your poison. You may even find a spot where you can put your fists thumb side toward you. Excellent. So that should bring some blood flow back there, release any extra little tension that we have back there. All right, so let's bring our attention and awareness to the lower lobes of our lungs. So we not only want to expand this way, we want to expand laterally. So if your arms allow you, you can cross over and feel those expand underneath, or if it's more comfortable in this position. For me, it's more comfortable this way. So I'm going to have my hands on my ribs here and bring my attention to the lower lobes of the lungs. Plus, when we have our hands crossed over, it kind of forces our air into our lower lobes of our lungs because there's not the extra space up here. It's compressed a little bit. So just taking a few breaths here. Concentrating on that sensation, not only in the ribs, but the sensation of possibly the skin over the rib cage. It's tracking underneath your fingers. And you can even kind of grip your skin to allow the ribs to move underneath them, just like we were holding our upper body straight while we were moving our hips beneath our shoulders. Excellent. So let's take our hands to our chest and think of bringing our breath here into the middle lobes of the lungs. And even feeling for those lower lobes underneath our forearms as they rest here. Again, we're thinking of opening and expanding. Lifting and expanding. Again, feel for the movement of the ribs. You might even feel the heads of the ribs on the sternum. If they feel stiff, you're welcome to give them a little bit of a awakening there. A few more breaths. Excellent. And now you can cross them over, feel right beneath your clavicles. So we're headed towards those upper lobes of the lungs. And just allowing the weight of our arms to rest down on the lower lobes so that it helps to, once we fill those lower lobes, the upper lobes can continue to expand. Think of filling from the bottom first. Check in, make sure those sits bones are directly underneath you, not poking forward or back. Excellent. So from here, we're going to actually bring our body forward. So we've got the weight of our body in our arms. And I want you to think of taking your breath into your back. Think of like a ladybug spreading her wings. Feel the rib cage move along the skin underneath it. And even think of trying to feel where the rib cage attaches into the spine. Feel those the heads of the facets mobilize as we breathe out and expand, and then allow them to come down as we exhale. Feel those wings expand all the way from the bottom where you start to open them up. You are opening them up, getting them ready, and then starting that motion of bringing the breath down as your wings come down. Inhale as they lift up, and exhale down. Continuing to bring your breath into the back of the body. And now bring your attention and awareness to the back of the heart. Think of opening that area. Opening yourself to receiving love from yourself and others. And taking our attention and awareness down into those kidneys, loosening up the superficial tissues. Feel your kidneys move down as you breathe in. And feel them gently rise as you exhale. And on your next exhale, taking your hands to your knees gently, think of rolling up one vertebrae at a time, stacking them up from the lower back onto that sacrum. Initial two vertices are right underneath us, stacking it up and rolling those shoulders back and down. So now let's take our breathing into this position now that we're up in gravity. Feeling those lungs expanding. Again, both this way and laterally. Just like importing. Excellent. Thank you for taking the time to participate in this breathing practice, and I hope you continue to incorporate it throughout your days, and look forward to seeing you again soon.